You're listening to Focus on Health, our weekly health program with me, Kuenzang. Ever since the HIV/AIDS prevention program was launched to sensitize the third gender community in the country, not many have come forth to avail the service. The service is rendered to the third gender community such as gay men, transgender and intersex people who practice MSM, men having sex with men. To know more on this issue, we bring you a program titled Reaching Out to the Third Gender Community in Bhutan. Although not many of them have come forward to become active members of the program with Laksam Network of HIV-positive people, the Assistant Program Officer of National HIV/AIDS Control Program, Jigmitile, said the current program is the only means to reach the LGBTI and Q community and sensitize them on the health issues. The National HIV/AIDS Strategy, calling for renewed efforts to reduce and prevent HIV infection rates among vulnerable and high-risk populations, was done mainly in line to the findings which stated that lesbian, gay, bisexual, transgender, intersex and queer are 18 times more vulnerable to sexually transmitted infections than straight people. However, after Laksam took charge of the program in 2013, the number of members has increased. Currently, there are around 20 active members working with Laksam who meet regularly to mobilize discussions around issues affecting MSM and transgender in Bhutan and also to identify more peer educators. To know more on this, the program manager of Laksam, Thong explains.
Currently, we have around approximately 30 with us. 8 members are hidden and we have 20 actively participating with us. Some are health workers, some are undergraduates, some are students, and most of the TG, they are school dropouts. They couldn't continue their education. They are doing small works in Dayang, parlors. And currently, the active member who is helping, we have 4 members. They are working with me in how to handle with the problems. And whenever I have a problem, I used to give a call to them so that I can contact their friends to them. As of now, whenever we have problem, we're very active participants in any meetings, any trainings, any forum we conduct for them. In our project, we have activities like PHU 1.1, 1.2, 1.5 and 1.1. Our activities divided. First is networking and second is advocacy. Third is development of brochures, distributions of brochures, convene forum, and we have observations of idea hordes. So as of now, we have 3 convene forum, where in convene forum we discuss about whatever issues they are having within their community, what they want to do. They will be sharing their human stories. In case of them, nobody is feeling for them. They just want to prove I'm woman. So why we brought them? It's because they are very much vulnerable to HIV. Our main objectives of the project is to reduce the impact of HIV on MSM and TG's population. So if we are not involving them, then it will be very much difficult to get zero HIV status in the South Asia.
Also, an assessment on stigma and discrimination impacting universal access to HIV and health services for MSM and transgender people in Bhutan by the Health Ministry have found a significant level of homophobia and misconception about homosexuality and layered stigma among healthcare providers.
It might be quite surprising to everyone and it may not be surprising. We have to protect them, we have to respect them. Since we are not respecting, since we are discriminating them, they are very much reluctant to go and seek health service, which means that health service should be one of the individual's rights. That in case of them, because of the discriminations from the health sectors, because of discriminations from the surrounding, because of the certain circumstances, they are very much reluctant to go and get a treatment. Even if they have, in case I have members who have recently knew that she transgender, she's infected with syphilis. It was detected in VOL-HD, voluntary testing. She's saying that everyone is saying that I have a syphilis, I need to do a treatment. Then I said, you have to do treatment. There's a cure, you have to take injections and you can be cured. But I'm scared, which means that still she is not that much comfortable to go and seek the health service. So if we are not supporting them, if we are not respecting them, since they are very much vulnerable to get HIV, I'm pretty sure that it will be our country laws, if we are not supporting them, because we never know once we have praised them, if we never try to recognize them, then if they keep on doing the works in underground, then we never know who is the straight person, who is the MSM, who is getting HIV. We never know straight like us is MSM or TG. They are really in stress, Shinila.
According to program manager of Laksam, most MSM and gay are married, and that was the main reason that kept them in hiding and from availing the service. She also added that the awareness level is much effective judging by that networking.
In case of hiding one, we never force them to come out because some are with family, they already got married and have a children. And some are very much scared, they are studying. We don't want to disturb them, but we just want to let them know that we have our services. We are always there with you. We want to give our services when you're having a tough time. Come to us. Same like just now in our country, we are very much concerned about the teenage pregnancy, teenage societal, in case of the women, female now. My question here is for all the general public and all the high-level people. What in case teenage guys, teenage MSM become a victim of the elder men? I know he will never get pregnant, but he might be raped. He might be injured. The problem is that physically he is not getting pregnant, but he's raped, he's tortured, he's under stress. This is a question for all the people. Did you ever thought of those guy victims? Did you ever thought of those teenage MSM who's studying in schools? We never want to force anyone to come in our conditions. But I just want to keep this caution for them. In case of networking, I'm involving all of them. And recently we have conducted a peer education training for all the MSMs and TG so that they can have background knowledge when they're dealing with their co-members. Because it will be very much difficult if you go and network people. But if you go themselves and do a networking, then it will be much effective than us. Because individuals have a different problem. Because we are totally different. I would say they're different because whatever they think, whatever we think is totally different. If I go and talk to one of the HIV people, they will never understand what I'm talking. If I'm HIV positive and if I talk to HIV positive, there will be much impact. If one MSM talk to another MSM, it will be much effective. Same like TG. If one TG goes and talk to another TG, then she will be assured like, yes, I have a friend. Yes, I have my own community. It's gonna be helpful to the general population because in the advocacy program, we gather more than 250 people. In 250 people, we never know how much is straight, how much is TG, and how much is MSM. Because of the discrimination stigma, some MSM, they do much work in the underground. Because of anal sex, you are getting transmissions of the HIV and other diseases, and you are very much prone to get HIV. So if I go and advocate, they will never know. Because if we MSM go and advocate that we have this type of complications, we have this much chances of getting HIV because of the anal sex, that will be more effective and it will be much beneficial for all the general public.
Meanwhile, Focus on Health also spoke to the 23-year-old Deshin Selden, who revealed his transgender status in 2008 when he was 16 years old. Born a boy in Paro, he knew from a young age that he was meant to be a girl, but it wasn't until the age of 14 that he made the definitive decision to assert his true gender. With this quote, let's now listen to Deshin Selden. Now that you have come out and then you have decided to lead your own path, how do you see the way you choose to live your life?
I've chosen my way. It's right for me because I know what I'm supposed to do and what exactly I am, and I'm living my life the way I want and God has created me like this. So I think this is the right decision which I've taken because this is my real life. So I'm happy.
Now, talking about this specific thing, you have come out and then it looks like now everything is okay with you. So how did this whole thing started?
From my childhood, I was very girlish. I never wear a male dress. I always want to wear a kira or some skirts or something like this. But I never knew that I'm a transgender. I'm just thinking that I'm normal. And when I reach class 7, then I can't go in school and continue my studies because this is not me, So I have chosen to wear kira, and I have taken a decision in 2006 to wear a kira and continue my studies. And I think like I have given an interview to Bhutan Observer, Bhutan Times, and all through that I think I got lots of help from Minister of Education and even from the Minister of Health. That's what I started my journey. Very difficult for me to start my journey from that time, because like suddenly I started wearing kira in school, and and people making me as a clown or something like this, but I'll never lose my hope. It's like I know what I am, and I always try to be myself, and it's not that like I have interest to wear kira or something like this. I think I'm a simply girl, and so I've changed my school. The Minister of Education helped me to choose any school that I want to. When I were first time in Kira in school, I think the teachers and the student helped me a lot. Especially in Shari School, I've continued there. So the principal, the teachers were very supportive, and even the students were very supportive. They never make fun of me. They come to me, they support me. The principal and the teachers already have talked with the student, so I think the reaction was positive. My families, they really support me, and they never treated me like transgender or something like that. My brother, my sisters, and my mom, dad, I think they're much proud that I'm their daughter.
Do you have a goal for yourself?
I think like everybody can dream, but I never had dream. But my main aim is to help those people who can't come out and lead their life. That's my main goal, because like I came from that journey. It's very difficult to be yourself and ask for your rights. I just want to help those people who is like cross-dresser, or it could be a transgender, it could be a lesbian, gay and bisexual, for the LGBTI rights.
That's all we have for you today, and we hope you had an informative time listening to the program. Until then, this is goodbye from me, your host Kuenzang, and thank you for tuning in.